In this video, we will cover cardiogenic shock. Cardiogenic shock is the failure of the heart to pump blood adequately to meet the oxygenation needs of the body. It occurs when the heart muscle loses its contractile power. Cardiogenic shock is a life-threatening condition and it occurs when the heart's ability to contract and to pump blood is impaired and the supply of oxygen is inadequate for the heart and the tissues. It most commonly occurs in association with and as a direct result of acute myocardial infarction. But not everyone who has a heart attack has cardiogenic shock. It can be fatal when a lack of oxygen causes the organ to fail. It is a rare condition. It is often deadly if not treated immediately. When treated immediately, about half the people who develop the condition can survive. Causes of cardiogenic shock. The causes of cardiogenic shock are known as either coronary or non-coronary. Coronary cardiogenic shock is more common than non-coronary cardiogenic shock and is seen most often in patients with acute MI resulting in damage to a significant portion of the left ventricular myocardium. Patients who experience an anterior wall MI are at greatest risk for cardiogenic shock because of the potentially extensive damage to the left ventricle caused by occlusion of the left anterior descending coronary artery. A heart attack is the most common cause of cardiogenic shock. A severe heart attack can damage the heart's main pumping chamber. When this happens, the body can't get enough oxygen-rich blood. In rare cases of cardiogenic shock, it is the bottom right chamber of the heart is damaged. Non-coronary causes of cardiogenic shock are related to conditions that stress the myocardium. For example, severe hypoxemia, acidosis, hypoglycemia, hypocalcemia, tension pneumothorax, as well as conditions that result in ineffective myocardial function that, for example, cardiomyopathies, valvular damage, cardiac tamponade, dysarrhythmias. Other conditions that make the heart weak and can lead to cardiogenic shock include a large section of heart muscle that no longer moves well or does not move at all, breaking open or rupture of the heart muscle due to damage from the heart attack, inflammation of the heart muscle, that is myocarditis, and infection of the heart's inner lining and valves, that is endocarditis. An abnormal heart rhythm, that is arrhythmias, dangerous heart rhythms such as ventricular tachycardia, ventricular fibrillation or supraventricular tachycardia, very slow heart rate rhythm, that is bradycardia or problem with the electrical conduction system of the heart. Too much fluid or blood around the heart cause pressure on the heart, that is pericardial or cardiac tamponade. A blood clot that suddenly blocks a blood vessel in the lung, that is called pulmonary embolism. A heart valve problem such as an artificial valve not working right or tear or rupture of the muscle or tendons that support the heart valves, especially the mitral valve. Tear or rupture of the wall, that is septum, between the left and the right ventricles. Cardiogenic shock can be caused by heart failure or injury to the chest. Now we will see the pathophysiology of cardiogenic shock. Myocardial injury from ischemia, cardiac structure problems, dysarrhythmias can cause myocardial dysfunction. Myocardial dysfunction causes systolic and diastolic dysfunction. The heart's inability to pump the blood forward is called systolic dysfunction. The most common cause of systolic dysfunction is acute MI. This inability results in low cardiac output and cardiac index. This leads to decreased cellular oxygen supply and decreased BP. Compensatory vasoconstriction and fluid retention will take place to preserve organ perfusion, but it results in worsening myocardial dysfunction causes ischemia. On the other hand, diastolic dysfunction, that is inability of the heart to fill blood, causes increased left ventricular end diastolic pressure, which leads to increased left wall stress and increased pulmonary pressure, pulmonary congestion and pulmonary edema. Pulmonary congestion and edema might impair gas exchange, aggravate tissue hypoxia, increase work of breathing, increase right ventricular afterload from hypoxic pulmonary vasoconstriction, and exacerbate myocardial ischemia, which results in deterioration of ventricular function. If therapeutic intervention do not restore cardiac output and organ perfusion in a timely manner, coronary and systemic hyperperfusion and multi-organ failure become progressively worse. Ischemia from both systolic or diastolic dysfunction further worsens myocardial ischemia, causes cardiogenic shock, and it can lead to death. Stages of cardiogenic shock. Cardiogenic shock stages range from being at risk to being very ill. Stage A, that is at risk. Heart disease such as heart attack or heart failure may be present but no signs of shock. Beginning, that is B. Low blood pressure or increased heart rate but no hypoperfusion. Next stage is classic, that is C. Symptoms are present with hypoperfusion. Patient need medicines or devices to get blood to the organs. Next stage is deteriorating, not responding to medicines or devices and getting worse. Next stage is extremis, E. Cardiac arrest that needs CPR, ventilator and defibrillator. Signs and symptoms of cardiogenic shock. Patients in cardiogenic shock may experience the pain of angina, develop dysarrhythmias, complain of fatigue, express feelings of doom, and show signs of hemodynamic instability. Because cardiogenic shock usually occurs in people who are having a severe heart attack, it is important to know the signs and symptoms of a heart attack and to get immediate treatment if client has any symptoms of a heart attack, such as chest pain that lasts for more than a few minutes or goes away and comes back. The chest may feel heavy, tight, full or numb. Client may feel pressure, aching, burning or squeezing pain on the chest. The pain may feel like heartburn. In some patients, especially women, chest pain isn't always the main symptom. Be alert for other signs such as pain or discomfort in the upper body and or down the left arm, pain in the upper abdomen, throat or jaw, trouble breathing, sweating, fast or irregular heartbeat, feeling very weak, lightheaded or anxious, nausea and vomiting. Cardiogenic shock takes place when the heart is unable to supply enough blood and oxygen to the organs of the body. Other symptoms related to cardiogenic shock can include fainting, swelling in the belly and legs, lack of appetite, low blood pressure, confusion, restlessness, mental lethargy due to poor perfusion of brain. Oliguria, urine output less than 30 ml per hour. Patient may have pale, cold, clammy skin. Patient may have weak, thready peripheral pulses, fatigue, hypotension. Increased left ventricular pressure result in elevation of left atrial and pulmonary pressure causing pulmonary congestion. Because of that, the patient may have dyspnea, tachypnea, cyanosis. Patient may have dysarrhythmias due to lack of oxygen to heart muscles and sinus tachycardia as a compensatory mechanism for a decreased cardiac output. Patient may have decreased bowel sounds due to paralytic ileus from decreased perfusion to GI tract. Metabolic acidosis due to increased lactate production and reduced clearance caused by anaerobic metabolism and liver dysfunction. Cardiogenic shock may cause loss of consciousness and patient may be in coma. Diagnostic evaluation. A physical exam will show low blood pressure, most often less than 90 mmHg in systolic. Blood pressure that drops more than 10 points when stand up after lying down, that is called orthostatic hypotension. Weak, thready pulse, cold and clammy skin. Chest X-ray are taken to look for fluid in the lungs, pulmonary vascular congestion, and get pictures of the heart and blood vessels. Next is cardiac catheterization. This procedure helps to find blockages in the artery that supply blood to the heart. A long, thin tube called a catheter is inserted through a small puncture, usually in the wrist or groin, and placed in the lung artery. That is called right heart catheterization. Tests may show that the blood is backing up into the lungs and the heart is not pumping well. ECG and echocardiogram has to be done to the patient. Lab tests to find out abnormally elevated cardiac enzymes, elevated blood urea nitrogen and creatinine, elevated liver enzymes, increased PTT and PT, elevated serum lactate, elevated brain natriuretic peptide, arterial blood gas to check the oxygen level in the blood, complete blood count, thyroid stimulating hormone test to be done. Management and treatment. Cardiogenic shock is a life-threatening condition and need emergency treatment. The most important part of treatment is improving the flow of blood and oxygen to major organs to avoid damage. Sometimes this can be achieved with medications. In more severe cases, support devices may be needed to help the heart. Treatment that begins in a hospital emergency room or intensive care unit may include medications given through an IV to help remove excess fluid, improve blood flow, and support the heart function. Oxygen to help the breathing. Placement of a temporary monitoring line called a Swan-Ganz catheter, which is a special catheter that monitors the pressures inside the heart. This can help the healthcare team to closely follow the response to treatment. Now we will see the medications. Vasoactive medication therapy consists of multiple pharmacologic strategies to restore and maintain adequate cardiac output. In coronary cardiogenic shock, the aims of vasoactive medication therapy are to improve cardiac contractility, to decrease preload and afterload, to stabilize heart rate and rhythm. Because improving contractility and decreasing cardiac workload are opposing pharmacologic actions, two types of medications may be given in combination: ionotropic agents and vasodilators. Ionotropic medications increase cardiac output by mimicking the action of the sympathetic nervous system, activating myocardial receptors to increase myocardial contractility, that is ionotropic action, or increasing the heart rate, that is chronotropic action. These agents may also enhance vascular tone, increasing preload. Vasodilators are used primarily to decrease afterload, reducing the workload of the heart and oxygen demand. Vasodilators also decrease preload. Fluids and plasma are given through an IV. Medications to treat cardiogenic shock are given to increase the heart's pumping ability and reduce the risk of blood clot. Drugs can decrease the workload of the heart by dilating coronary arteries and reducing preload, afterload, and heart rate and contractility. Medicines include nitroglycerin. IV nitroglycerin in low doses acts as a venous vasodilator and therefore reduces preload. At higher doses, nitroglycerin causes arterial vasodilation and therefore reduces afterload as well. These actions in combination with dobutamine increase the cardiac output while minimizing cardiac workload. In addition, vasodilation enhances blood flow to the myocardium, improving oxygen delivery to the weakened heart muscles. Next is ionotropic agents such as dobutamine, dopamine, and milrinone. These medications improve the pumping function of the heart, may be given until other treatments start to work. Dobutamine produces ionotropic effects by stimulating myocardial baroreceptors, increasing the strength of myocardial activity and improving cardiac output. Myocardial alpha adrenergic receptors are also stimulated, resulting in decreased pulmonary and systemic vascular resistance. Dopamine is a sympathomimetic agent that has varying vasoactive effects depending on the dosage. It may be used with dobutamine and nitroglycerin to improve tissue perfusion. Low doses improve contractility, slightly increase the heart rate, and may increase cardiac output. High doses can cause vasoconstriction, which increases afterload and thus increases cardiac workload. Because this effect is undesirable in patients with cardiogenic shock, dopamine doses must be carefully managed. Next drug of choice is vasopressin. It is an antihypertensive drug that raises blood pressure by constricting blood vessels, thereby increasing systemic vascular resistance. This is different from ionotropes, which increases the force of cardiac contraction. Some substances do both, for example, dopamine and dobutamine. Other drugs which used for cardiogenic shocks are diuretics such as furosemide, may be given to reduce the workload of the heart by reducing fluid accumulation. Antiarrhythmic medications. Multiple factors such as hypoxemia, electrolyte imbalance, and acid-base imbalance contribute to serious cardiac dysarrhythmias in all patients with shock. In addition, as a compensatory response to decreased cardiac output and BP, the heart rate increases beyond normal limits. This impedes cardiac output further by shortening diastole and thereby decreasing the time for ventricular filling. Consequently, antiarrhythmic medications are required to stabilize the heart rate. Aspirin is also usually given immediately to reduce blood clotting and keep blood moving through a narrowed artery. Client can take an aspirin while waiting for help to arrive only if doctor has previously told to do so for symptoms of a heart attack. Antiplatelet medications also is to be given to prevent new clots from forming. These medications include clopidogrel, tirofiban, and eptifibatide. For a patient in cardiogenic shock, the overall goal is to restore heart function and the balance between oxygen supply and demand in the myocardium. Until these interventions are done, we must support the heart to optimize stroke volume and cardiac output to achieve optimal perfusion. If medications don't work to treat cardiogenic shock, the client may need surgery. Surgical procedures to treat cardiogenic shock usually focus on restoring blood flow through the heart. An intra-aortic balloon pump is a device that helps the heart pump more blood. Doctor inserts a balloon pump in the main artery of the heart. The pump inflates and deflates within the aorta, helping blood flow and taking some of the workload off the heart. If client is having a heart attack, angioplasty and stenting may be done. If a blockage is found during a cardiac catheterization, the doctor can insert a long, thin tube equipped with a special balloon through an artery, usually in the leg, to a blocked artery in the heart. Once in position, the balloon is briefly inflated to open the blockage. A metal mesh stent might be inserted into the artery to keep it open over time. In most cases, the doctor will place a stent coated with a slow-releasing medication to help keep the artery open. If there is a valve problem, heart valve repair or replacement to be done. Sometimes an injury, such as a tear in one of the heart's chambers or a damaged heart valve, can cause cardiogenic shock. Surgery might correct the problem. If client has fluid around the heart, a procedure that uses a needle to remove excess fluid compressing the heart to be done. If client has several blocked coronary arteries, coronary artery bypass surgery to be done. Coronary artery bypass graft to help more blood get to the heart. This surgery uses a healthy blood vessel in the leg, arm or chest to create a new pathway for blood so it can flow around a blocked or narrowed artery. If the heart remains too sick despite other treatments, the client may require a machine that temporarily takes the workload from the heart and the lungs. Extracorporeal membrane oxygenation. It helps improve blood flow and supplies oxygen to the body. This process continuously pumps blood out of the body to a heart-lung machine that adds oxygen and removes carbon dioxide and sends oxygen-filled blood back to tissues in the body. If the heart function isn't expected to improve, a left ventricular assist device to be implanted or a heart transplantation to be done. Ventricular assist device is a mechanical device can be implanted into the abdomen and attached to the heart to help it pump. A ventricular assist device might extend and improve the lives of some people with end-stage heart failure who are waiting for a new heart or aren't able to have a heart transplant. Ventricular assist device may be used as a temporary measure for the patient in cardiogenic shock who is waiting heart transplantation. The goals are to decrease SVR and left ventricular workload so that the heart can heal. If the heart is so damaged that no other treatments work, a heart transplant may be a last resort. Heart transplantation is an option for a small, select group of patients with cardiogenic shock. Possible complications of cardiogenic shock is liver damage, neurologic impairment or stroke, acute respiratory distress syndrome, renal failure, cardiopulmonary arrest, dysarrhythmia, ventricular aneurysm, multi-organ dysfunction syndrome, bowel ischemia, limb ischemia, and death. Client may reduce the risk for developing cardiogenic shock by quickly treating its cause, such as a heart attack or heart valve problem, preventing and treating the risk factors for heart disease such as diabetes, high blood pressure, high cholesterol, and triglycerides or tobacco use.